So in this and all VALA meeting spaces, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. As VALA, we are welcoming, respectful, kind and forgiving, and we take responsibility for upholding the VALA Code of Conduct in all our meeting spaces. My name is Michelle McLean. I'm the current VALA Vice President, and I'm pleased to welcome you to this presentation from our VALA Award Winners for 2025. So Cass, do you want to see if your presentation will work?
Absolutely.
Thank you. And then we'll get started.
How are we going? It's up.
Beautiful. That is wonderful. So to get us
Excellent.
started, we have the first of our winners, represented by Cassandra Gorton from Monash Health. So Monash Health's project was AI Search Tools Matrix and Education Program. And their aim was to evaluate and recommend tools that enhance evidence-based healthcare research while avoiding bias. And without giving anything else away, I'll pass over to you, Cass.
Thanks, Michelle. Good afternoon, everyone, and thank you for the opportunity to present on our project. I'm Cass Gorton, and I'm joined by my colleague, Karen Moskell. I'd like to begin by acknowledging the Bunurong and Wurundjeri Woi-wurrung peoples, the traditional owners of the land on which Monash Health operates. I pay my respects to elders past and present, and extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. In this presentation, we'll give you an overview of our organisation and the need for timely AI advice. We'll explore the process of developing a matrix of AI tools and the creation of a complementary education series. We'll also showcase how the tools were evaluated and share practical advice for designing an effective education program, including delivery, promotion, and evaluation. So let me start by giving you a quick snapshot of the context for this work. Monash Health is Victoria's largest public health service. It's a big organisation with more than 20,000 staff working across 7 hospitals and a broad range of community-based services. Our footprint covers southeast Melbourne, and we serve a catchment area of over 1 million people. Within that environment, the library team plays an important but often behind-the-scenes role. We operate 5 physical library sites, and our team adds up to just 6.3 FTE. Despite being relatively small in size, our impact is broad. Our library users are all Monash Health employees, doctors, nurses, allied health professionals, researchers and managers. Everything we provide, from resources and education through to training and tailored services, is designed with one goal in mind: to support better patient care. That includes helping clinicians make evidence-based decisions at the point of care, supporting health research, and contributing to improvements in how health services are delivered across our organisation. In order to stay up to date with the rapid pace of health research and the constant emergence of new research tools, our library team makes a point of doing structured internal learning. We kicked this initiative off in 2022 with a deliberate focus on digital tools that support different stages of the research process. We looked at tools that help with searching, citing, screening, and writing. Each of our librarians took part in trialling and reviewing these tools. We explored how they might improve efficiency, accuracy, and the overall research experience. Along the way, we shared our insights in team discussions. We compared notes on what worked well, what didn't, and where the real opportunities may lie. This process gave us a clearer understanding of the strengths and limitations of each tool and helped us build confidence in evaluating them. But as valuable as these internal conversations were, we quickly realised something important. It wasn't enough just to exchange knowledge within our team. We needed to take the next step to turn what we had learned into practical, actionable advice that we could not only use ourselves, but also share with our users to guide their choices. And this is critical because our users are incredibly time poor. By doing this evaluation work up front, librarians save them trial and error process and provide trusted evidence-based recommendations. It also positions the library as a leader within the organisation, proactively shaping how research is done rather than simply responding to requests. So that raised some key questions for us. Which tools would we actively recommend for which tasks? And perhaps most importantly, why these tools over others? And that's where our work began to shift from exploration to application. To provide structured guidance to our users, we decided to start with one specific area: citation mapping tools. Now, there are a lot of options out there, and it can be overwhelming for a busy clinician or researcher to know where to begin. So our team set out to compile an extensive list of what's available. We then evaluated each tool against a set of critical factors: cost, ease of use, the level of product support, and how well they handled import or export data. But we knew just handing over a long list wasn't going to be particularly helpful. To make the information clear and digestible, we rated and ranked the tools. We also highlighted best for use cases. This approach gave our users quick insights, helping them match the right tool to their specific needs without wasting time on trial and error. All of this was pulled together into a citation mapping matrix, a one-stop comparison table that lets users see at a glance how the tools stack up against one another. This matrix has become a practical resource because it allows people to go straight to the option that best fits their requirements. So we didn't stop there. To make sure the resource reached the people who needed it most, we embedded it directly within our literature searching guide. So this is a guide that's accessed more than 1,000 times every month. So it's right at people's fingertips when they're already engaged in the research process. And because we know that people also learn well through direct engagement, we promoted the matrix through our education series, and Karen will walk through that series in more detail. Stepping back, what's important here is that the process of evaluating, refining, and sharing practical advice on citation mapping tools has strengthened our own internal expertise as a team. More importantly, it's empowered our users. They can now navigate the increasingly complex landscape of digital research tools with greater confidence and effectiveness. And this became the model for how we approached our AI search tools. Now let me walk you through the citation searching matrix we developed. In this matrix, you'll notice key details such as cost, product support, and import-export options. These are critical considerations for most researchers when selecting the right tool. It's worth noting that our full internal evaluation actually covered a broader range of factors, things like tech specs, advanced integration, and other features that are important to us as librarians. However, based on feedback from our users, we decided not to include every criterion in this summary. Some of the details, while valuable to us, were less relevant for the end user. By streamlining the matrix in this way, we aim to create a practical, user-friendly guide, one that helps researchers quickly identify the best tools for their specific needs. In other words, it's not just a list of tools, it's a decision-making shortcut. It helps users cut through the clutter and get straight to the tool that will work best for them, saving time and reducing frustration. And this approach, focusing on what matters most to our user, is something we carry forward through all of our guidance and resources. With the release of ChatGPT in November 2022, the world quickly witnessed a surge of discussion about how this tool could transform the world. And with the excitement, there was also a reason for caution. One of the biggest concerns with AI tools was their tendency to hallucinate or generate inaccurate, misleading, or even completely fabricated evidence. In our context, this can have a disastrous consequence on patient care. Recognizing this, we saw a chance to position ourselves as leaders in promoting best practice. To support our users in navigating this new landscape, we developed and delivered a comprehensive webinar. The aim of this education was clear. We wanted users to understand how to leverage these tools while maintaining the highest standards of integrity and ethics. By highlighting both the opportunities and the risks, we were able to position the library as not only a hub for resources, but a trusted guide in responsible AI use across research and healthcare. And this work continues to be increasingly relevant as AI tools are now becoming part of everyday practice. Helping users navigate them safely and effectively is something the library leads, turning potential uncertainty into an opportunity for education. To further advance our AI education program, we built upon our successful citation mapping matrix and used it as a prototype for evaluating AI-powered search tools. It was essential that we help our users navigate this new territory by providing them with clear, evidence-based evaluations of the tools they may encounter. Our first step was to collate a comprehensive list of tools that utilize some form of AI to contribute or enhance the search process. After an exhaustive review, we identified approximately 23 tools. These range from those designed for academic research to broader internet-based search tools and everything in between. To create a meaningful ranking, we evaluated each tool based on several criteria: source reliability, One of the most important aspects we assessed was where the tool sourced its information from. We categorised tools based on whether they drew from academic and scholarly databases, whether they simply scraped information from the open web, or whether they were unclear or didn't even say where they sourced their data from. This distinction was crucial as users seeking peer-reviewed, high-quality research need tools they can trust. Next, the user interface. How easy the tool was to use. We examined whether the interface was intuitive and user-friendly, or whether it presented a significant learning curve that might hinder less tech-savvy users. This helped us determine whether a tool was suitable for beginners or best suited for experienced researchers. Access to full text. We assessed the availability of full text articles. For tools focused on academic research, we determined whether users could access PDFs or link to the original resource, or whether the tool provided no reference at all. This was especially important for researchers needing comprehensive access to literature in order to critically appraise it. Cost. We carefully analysed the cost associated with each tool. Some were completely free, while others had limits on free access, such as capping the number of searches or requiring payment for advanced features. Additionally, we looked for hidden costs, such as charges for premium support, or accessing certain data sets, and we included that within our ranking. And access to support is vital for our users who may encounter issues. We evaluated whether the tools provided adequate user support. Was there a help desk, live chat, or email support? Or was support limited to a basic FAQ page? Some tools offered no support at all, which could leave users stranded if they encountered technical difficulties or needed clarification on how to use the tool's features. Using these criteria, we developed a ranking system that provided a clear and concise summary of each tool. Like our citation mapping matrix, we structured the rankings to be user-friendly and actionable, enabling our users to quickly identify the best tool for their search needs. In our AI search matrix tools, we also included an honourable and dishonourable mentions list to demonstrate that we had done a comprehensive evaluation of many tools, not just the top ones listed. The matrix also served as a valuable addition to our ongoing AI education program. By sharing our findings through live webinars, detailed guides, written reports, we ensured that our users and the greater research community had access to the most up-to-date information on how AI search tools could complement their research efforts, while also highlighting the limitations and risks associated with relying on AI-generated search results. Through this evaluation process, we continue to build on our reputation as a trusted source of guidance on emerging technologies, empowering our users to leverage AI in research responsibly and effectively. I'm now going to hand over to Karen.
Thanks, Cass. So the next step was to develop this content into a set of webinars. So back in 2023, we began by scoping out our objectives for a training series on the use of AI in healthcare research specifically. And this slide sort of presents an overview of some of those key objectives that we looked at. Our target audience included a wide range. So it was really across our Monash precinct, which is researchers, clinicians, clinical educators, students, and that encompasses staff across hospitals, community sites, as well as partner organisations such as Monash Uni and research centres. And we worked under the assumption that there would be varying levels of familiarity with emerging technologies like AI, with some already experimenting with the tools, while others were just beginning to ask what AI might mean for their work. So the overall training goal was to build awareness of how AI is used in healthcare research. We wanted to demystify the technology and show practical use cases grounded in real-world examples. And we also aimed to critically examine the limitations. So we all know that AI tools can be quite powerful, but they're not always appropriate in healthcare research. And it was important that our audience understood when and when not to engage with AI. And to make the training accessible, we wanted to run live webinars so we could have some interactive learning elements and also recorded sessions for on-demand access. And these we wanted to embed within our learning management system. The webinars we wanted to schedule as a 30-minute online sort of lunch and learn session, so that would suit the needs of our busy and dispersed audience. And I'd just like to take a moment here to talk about the context we're working in and how this AI training needed to fit within our existing commitments. So as a team, we regularly deliver 8 research skills training sessions and respond to an average of around 4 in-service training requests. So we're already doing around 12 sessions per month across the team, covering topics on literature searching, critical appraisal, reference management, writing, publishing, and communicating research. And that's a significant workload for our team. Our staff resourcing and its sort of time management around this is a challenge. So that meant that we needed to, sort of plan these AI training sessions to fit in and around our regular program. Okay, so that takes us back to 2023 when we, so that's takes us back to 2023, where we started with our first webinar. And this was in direct response to the growing interest, or at times the alarm, around ChatGPT. So we did a ChatGPT sort of information and awareness webinar with demonstrations of practical use. In 2023, we also ran a webinar demonstrating citation mapping tools identified and evaluated in the matrix, as mentioned by Cass earlier, so to build on that work. And then, although not always strictly AI-powered software was mentioned in that citation mapping webinar, it did suit this training set because it sort of looked at algorithm-based tools and, when and when not to use them and where the information was being sourced from, so similar themes. Then in 2024, we ran a session specifically on AI search tools, including demonstrations and use cases, so things like Consensus and Semantic Scholar. And we also did an update on our ChatGPT session. But we also started to explore other large language models as part of this training, talked about things like Claude and Gemini, and in particular Copilot, as this was just being made available to Monash Health at that time. And so now in 2025, we've just recently run a session and we saw a shift sort of in a direction where we're looking more at the full range of AI tools, but less about each individual tool and more about sort of how they're used across the board in healthcare research, and with a focus on what the trends are, particularly in evidence synthesis searching. So the success of these webinars has led to requests from specific departments. So in the next few weeks, we're running AI training sessions specifically for nursing, for Monash Children's, for infectious diseases and hospital and the home departments across Monash. And we expect these kinds of custom department level sessions to continue to grow. So thereby really meeting the needs of these sort of unique cohorts. And although all of the training has variation in context thus far, we did sort of have a lot of key themes repeated throughout. And I'll just go through some of those key themes across all of these sessions now. So it was important to place the use of AI research tools within the scope of healthcare regulatory boundaries. And we always prefaced our training with national and local regulations, especially around data privacy, copyright, and responsible use in publication. And throughout, we evaluated limitations and ethical considerations, emphasizing transparency, reproducibility, tool bias, and the importance of safeguarding sensitive data. So the training was not only about awareness, but also about practical use. We incorporated use cases and demonstrations throughout where we could. We used large language models, for example, to showcase how we could brainstorm keywords or format data. We used and showed practical application of AI-specific search tools when assisting with a search or screening or automating data extraction. And so by understanding how the AI tools work and seeing them work, we aim to guide healthcare professionals to the support resources in our LibGuides, and then that would then in turn promote responsible and effective use. And all throughout this, we wanted to showcase the library as a trusted source. So by creating education resources and conducting this training, as Cass mentioned, we're positioning the library as a key voice in AI discussions. So we'll just move on to the next slide. And this is really just an overview of how we did, what impact did we have and where. So in terms of the training, the webinars, we had across the board 170 people attend the webinars with over 300 views watching the recorded content afterwards, and this is continuing to increase. So these numbers may seem small, but are considered a success in our specific sector. So we're keeping in mind that there are, immense time pressures on hospital-based clinician workforce. Feedback was overall positive, and these particular webinars rated highly relevant on all feedback forms that were received, which indicates that we were meeting the needs of our patrons. And I'll also add that the training also led to upskilling within our team. So almost all library staff were involved in these webinars at some point. And so that was a great way for all of us to keep on top of, newly emerging tools and changes with their interfaces, for example. At an organisational level, the library is playing a central part in talks with the Digital Health Department about integration of AI search tools, research tools, and we're currently in talks to implement the clinical key AI and up-to-date AI, and these are tools that can support clinical decision-making at the point of care, and it's great that we've got a seat at the table for those discussions. And also at the library level sector level, the Monash Health Library AI search matrices, those tables have been shared in JHILA, the Journal of Health Information and Libraries Australia publications. And we've also had this content talked about and shared by peers in other library webinars and PD training and on social media. So what next? As well as continuing to offer AI training on request, the library is looking towards embedding AI content into our existing research skills training. So maybe in future, instead of one-off institute-wide training sessions, they'll become part of our regular searching sessions that we do. We want to equip our patrons with the knowledge and confidence to engage with AI critically and constructively, and we want to do that in a way that's sustainable for our team. So that brings us to the end of our presentation. I wanted to thank you today to VALA for recognising this project, and thank you for attending today. So we're a small team, but we work towards supporting health research, evidence-based decisions, and contributing to improvements in how health services are delivered. And this is one way that we are making ourselves known in our sector. So thanks very much.
Thank you, Karen, and thank you, Cassandra. That was an amazing project. I have read about it in your submission, but to see it there just makes it even more amazing. So very, very worthy VALA Award winner. Has anybody got any questions for either Cass or Karen? Danielle, is that a hand up as disguised as a clap?
Just a clap, Michelle. It was fantastic.
Thank
you
you
both.
Thank you,
I'm
everyone.
happy to take questions after if you wanted to reach out at any time. That's perfectly fine.
It was a good reminder of the power of librarians to help people make their own discoveries, but using really reliable sources to do so. We get so used to librarians providing the answers, but what you've done here is just amazing for future healthcare. So on behalf of us all here, congratulations and thank you. Presentation and your work is sincerely appreciated.
Thank you, Michelle.
Thank you.
Okay, well, we might move straight into our second presentation. So our second presentation is from State Library of Queensland. Virtual Veterans Explore World War I Experiences. It was developed by TalkVia AI in collaboration with the State Library of Queensland. Virtual Veterans is an AI-powered chatbot designed to engage users with World War I history through the persona of a fictional veteran. And I'm pleased to hand it over to Anna Raunick from State Library of Queensland. Anna.
Michelle, just checking that you can see my screen.
We can. It's not in presentation mode yet, but they're there.
Okay, but we'll be in a minute. There, how's that?
Perfect.
Thank you, Michelle. Thank you, VALA, for the award. And I think thank you, VALA, for all your years and years, the committee work in this space, because I think it makes a big difference to all of us working in the sector and trying to explore different ways to use technology to do our work better and differently. I too wanted to acknowledge the traditional owners of the land on which we are meeting across Australia, I expect. So Virtual Veterans is, I think, an innovative venture designed to breathe life into our archival treasures about World War I. and it is amazing to be recognised by our peers. As most of you know, State Library of Queensland is based in Brisbane. Our vision is to be a library of influence, inspiring, connecting people through knowledge, storytelling and creativity. And I hope you'll agree that Virtual Veterans is a really great example of how we work to meet this vision. You may not know that we're also responsible for services at Anzac Square, Queensland's State War Memorial in the CBD. So we look after visitors' experience and engagement at the memorial. Our challenge was, how do we build engagement with our heritage collections, leverage new generative AI opportunities while managing the risk? So as Michelle mentioned, we work with local developer, TalkVia AI. We developed the concept of a virtual veteran or veterans, or Charlie as we later nailed him in a brainstorming session. And working with TalkVia, we then designed the background and the persona for this fictional veteran called Charlie. We established the guidelines for the subjects and the chatbot could address and the chatbot would not address. We trained an AI model using these criteria. I say we, but of course TalkVia did all the work. Refine the model to enhance its ability to retrieve relevant information. Tested and fine-tuned to ensure Charlie generated accurate responses. We started the project in February 24 with a delivery date that could not be extended, and that was Anzac Day in 2024, and we met this deadline. It was an iterative process with very regular meetings, fine-tuning after we saw beta versions, finding out that our collections and access have been designed for human interaction, and that was not always the best way to make our collections available when you think about collections as data. So Charlie is our AI guide to the rich collections of World War I, an AI-powered immersive conversational experience that offers students, history enthusiasts, an authentic entry point into World War I collections. Why World War I? Well, because we had the content. We had digitised thousands of collections as part of the centenary of World War I between 2014 and 18. So we had diaries and letters from the period, our link to Anzac Square, and also that we know we have a schools engagement team whose mission it is to engage students and teachers with our collections. And every year students from around Australia study World War I, so we knew we had an audience. What I've got now is a recorded demo of how AI works. And you can find Charlie on our Anzac Square website. And here it is. I'm typing in the question. Tell me more about what it was like for the soldier on the front line. You heard the audio there, which I've turned on, but I've closed it now. You can see there that one of the things we did, which in early 2024 was unusual, and that was to refer to the content that we were using to create the answers. Next, I selected one of the chips, which we put in there to stimulate for people that don't know what questions to ask. And again, as you pick a chip, you'll get collections will come up. Finally, I ask a question about, tell me more about the nurses. New content, you get your answer and you get your content. I then selected one of the letters from our collection and it will take me to that, to our catalogue and website. So this is from a collection by Canon Garland. There are over 140 letters in this collection, but Charlie's able to find the letter that speaks to and references nurses and takes you straight there. That's the end of the demo. Next, I wanted to talk about Charlie, the photo. As I said, the photograph we use for Charlie is not a real person. It's an AI-generated image using a custom AI model from Hugging Face, and it references World War I soldier portraits from our collections, and they're the portraits that were used. Charlie speaks using a Microsoft Azure synthesized voice, specifically the Duncan model. Despite the availability of numerous high-quality text-to-speech technologies, those featuring Australian accents still possess a subtle American inflection, rendering them less than ideal for this project, but we went ahead. We picked the best model, and there's a close-up of Charlie. Some of the feedback we received on going live was that Charlie was far too handsome. And my response was, if you were going to create someone, why not create someone that looks good? The other problem we had in early testing was, for some reason, the AI model just wasn't very good with hats. And after some feedback, we ended up taking the hat out of the equation and said Charlie was just going to have no hat on because we didn't want to get the hat wrong. As we saw in the demo, Charlie is supported by a number of features. Some were part of the original brief. It was important to us that there was no opportunity for Charlie to hallucinate, and that people using Charlie needed to have the opportunity to find out more, to get citations, and to understand where the answer came from. It's pretty standard now with chatbots, but as I've said, it was a great new feature in early 2024. We also identified the need for chips. When we were talking to people, it was like, oh, I don't know what question to ask. So the chips is a good way to stimulate and get people started. After we, again, did some testing with students and teachers, we did some refinement. They asked for options like being able to copy the transcript and put that into an assignment topic, export the cards that were created for later research and discovery, and to be able, and of course we added in the option to be able to log feedback and provide any updates on technical issues. The chatbot is also supported by FAQs on the website, which you can explore. Where does the data come from? It's over 1.3 million words from our digitized World War I collections, including letters and diaries of both men and women who served during the war in a variety of roles. We acknowledge that because of the time period and the information that was available and how First Nations people were treated at that time, we had no content that acknowledged First Nations engagement during the war, though we do, of course, know that there are many soldiers who fought during the war, and that's acknowledged in our frequently asked questions. We had more than 50,000 Queensland newspaper articles from between 1914 to 18 that we accessed through Trove, and the full 12 volumes of the Australian War Memorials, Official History of Australia in the War, 1914 to 1918 by Charles Bean. So it's a mixture of first-hand accounts from our diaries and letters, newspaper stories, and official records. So the response, lots of positive response in terms of the ability of using the technology. We did a lot of testing pre-go live with teachers, students, and members, our stakeholders in the military forces, including the RSL. We had some immediate negative response just to the concept of a library using AI, which surprised us. So it's like, why is State Library doing this? This is wrong. You should be employing staff, not creating virtual reality people. And then the other side of it was that it did not honour veterans because we were creating this artificial person. Why not ask a veteran? And it was quite interesting that in the social media chatter, people came back pretty quickly. There are no World War I veterans left. So, and we were honouring World War I by using diaries and letters and first-hand accounts. So that was an unexpected response. But then we went live on the 22nd of April, and as many of you will know or remember, within a couple of hours, the opportunity to jailbreak Charlie was discovered. And of course, it was shared and went viral. At least it felt viral when you're in my shoes. The jailbreak allowed users who had the right prompt to change Charlie's persona from a military soldier to Doctor Who or a ditzy blonde or your pet dog. TalkVia was notified, and within 2 hours, this hole was plugged. What was interesting is that TalkVia had built other publicly accessible chatbots, but this was the first time they had been attacked. Our response to the media was quite simple. We designed it to engage with audience. It sources its answers from, you can see it there, and that we're constantly refining it. But there's some of the headlines. When they say there's no bad press, that I'm not sure I agree with that after having sat through this. But, we also got a pretty amazing article in the Mandarin in July, which spoke about David Hodges writes about us and that we should be applauded for not scuttling our inventions at the whiff of controversy. These early fumbles are an essential part of the innovation process. So it was great to get that public recognition. And I wanted to acknowledge both our CEO and our library board, who were very supportive of our work and our actions. And then other feedback, this is the feedback from teachers and students, which has been very positive. Charlie had our Year 8 students highly engaged in a mini inquiry for Anzac Day, and I would highly recommend this. Then some of the data. So this is the data of use as of yesterday. So you can see there are 23,000 sessions. People spend an average of 8 minutes, which is pretty impressive when you think about what happens on our websites. Fair amount of questions and multiple questions. But I think what's really impressed me is that it's not just the Q&A. They are using it as a stimulus to go and explore more. And that's in all 3 collections. So you can see there in the pie chart, people are going into the State Library collection, into the Trove articles, as well as the World War I histories. If I reset this date indicator in the dashboard to the 22nd of the 4th, while the jailbreak was happening, 23 sessions becomes 37,000 sessions. So you can see some of those sessions were genuine people using Charlie, but a lot of them were people trying to break Charlie once the news got out that it was breakable. The data we receive through our dashboard includes the questions. So we can look at this at any time and see which questions. There's a lot of consistency in the questions, as well as which chips are being used. So that gives us, especially the schools team, a bit of interest and an insight into what people are looking for. Kids always ask really interesting questions as well as the obvious ones. They always ask questions about their pets and what they did and what they ate for breakfast and other stories. But, they ask questions about, Charlie, are you married? Do you have children? And all those sorts of answers. State Library, we have a use of generative AI principles document, which helps guide the implementation of AI projects and initiatives here. And as you can see there, the principles are based on accountability, transparency, privacy protection, and security. There's nothing sort of new in this, as well as contestability, fairness, and human society and human societal environmental well-being. And there's a link there that you can go back to, so those principles are publicly accessible. In 2024, last year, we were recognised by the Queensland AI community with an Outstanding AI Collaboration Award. It was fantastic for libraries and the GLAM sector, organisation sectors to be acknowledged by a broader ICT cohort. Some of our learnings, I think, as most things, be prepared. Think broadly and widely, factor in enough time, but then I would say don't factor in too much time in this space because the technology is changing as we're building it. Engage external stakeholders to test and validate and build that into your timeline so you can refine the product. Be prepared for the unexpected. Think we are so used to the community supporting stuff that we do. It was really interesting to get that backlash around the us being seen as being disrespectful, particularly as we had consulted with RSL and different military stakeholders. Think about the data you want to use. We focused on letters and diaries that were transcribed. We create that content and digitized collections, create transcriptions for people, not for computers. So transcriptions had headers and footers and logos and page numbers. All of that had to be stripped out of them so they could be used effectively. The Trove API is great, but we didn't think about the number of articles that were not transcribed. So they all had to be stripped out, and we could only use the ones that had been corrected by our volunteers. Working with an external developer, ensure there's clarity, what's in your standard contract agreement requirements, where is the data housed, are you collecting personal information, which we aren't with Charlie, who will have access to the data. Our agreement states that the data will not be shared with anyone else unless State Library gives pre-approval. It also notes that when we decide to say goodbye to Charlie, that the data will be returned to State Library. I encourage you, if you haven't given the Virtual Veteran and Charlie, to give it a go. There are so many opportunities for us to engage and explore new ways of understanding and accessing our collections. I know this is just the beginning. Thanks very much.
Thank you, Anna. Another amazing project. And again, kudos to State Library for stepping out into this new field, and another worthy winner. Time for questions, and I'd like to start with one. It must have been discouraging for your staff in a sense to get negative feedback, and especially to, be hacked pretty much as soon as you've launched. How did you manage that with your staff, just to encourage them to, stay on track and it's going to be okay?
It was like an afternoon of pain. So that was pretty, so it was very fast ongoing, and we had people in government telling us to take it down. So the media ringing us up pretty quickly. I think the very first step was, of course, to notify TalkVia. So we kept staff involved and knowledgeable about that. But since then, we, and of course, shared the fact that he'd been fixed, and then we got a lot of feedback about it doesn't work anymore, I can't break it. It's like, yeah, that's what's supposed to happen. But the interesting thing has been for us also to share with some of the staff who felt, vulnerable or upset, the good data that we're getting, both in usage, feedback from people that are using it, the good stories that have generated since then. And certainly for me, it was like 4 hours of pain compared to a year and a half now of fantastic usage.
That's great. Thank you. Any other questions? You've answered everything there, Anna. Thank you.
I have a quick question.
Yeah.
Sure, go, Karen.
Do you have any plans of rolling this out for some other collections?
We are talking about it, and the interesting thing is how big does the collection have to be meaningful? So, we had a lot of World War I letters. Do we have enough World War II content, for example, or would we do it for something else? So that's currently one of the conversations that we're exploring. I think it was a great idea to use the newspapers because there is so much content in newspapers, and you could certainly do it. It'd be really interesting to do newspapers maybe in a set of time period, but then say, what about Rockhampton during 1960s, and sort of do a prompt that way. So probably the easiest thing to do is the newspaper collection. But certainly looking at other collections like World War II in particular, with that anniversary coming up, But, you know, it'd be great to do is you might want to, we would love to do something in the First Nations space, but there isn't that much content that's, you know, first-hand First Nations experience. We do have a fantastic collection of over 30 oral histories of Australian artists. So I've been thinking that would be, and their contemporary stories, and to our oral histories. So there's a lot of words in the transcript. But by putting them all together in a chatbot like this, would you pick up trends? Would you be able to ask, you know, is William Robinson's childhood the same as Luke Roberts? So it does mean looking at your collection in a different way. Thanks.
Anyone else? In that case, thank you very, very much, everybody, for your attendance, in particular to Cass, Karen and Anna for their presentations today. They are all sincerely appreciated. For those who might have missed something, or if you want to let other people know about this, the recording will be available through the VALA website. Just give us a little bit of time. And we are fast in planning stages for VALA 2026, so watch the VALA spaces for information about the conference coming up next year. Thank you again, everybody. Appreciate your attendance.